So our moderator for this session is Dr. Linda Rudolph, who's a senior policy consultant to the Medical Society Consortium and has quite an extensive resume, and I urge you all to go to the program guide to check it out. Linda, welcome.
Thanks, Mona. And thank you so much, Senator Whitehouse. Your commitment, your command of this whole area is so important. And we very, very much appreciate all of your efforts over a long time to get us where we need to go to avert climate catastrophe. We have an incredibly exciting panel on climate, health, equity, and transportation. You can see all of the speakers here, and I encourage you, as Mona just said, to go and look at their bios in the resource guide for the conference. I won't be going through as we introduce them. I'm going to start with just a super quick introduction to why we're even talking about climate and health next, and transportation next. So here's the speakers again. Next. Transportation is now the sector that contributes more to our US greenhouse gas emissions than any other sector. In 2019, which is the last year for which there's data on the EPA website, transportation contributed 29% of US greenhouse gas emissions. Next. We also know that transportation has a huge impact on health through many different pathways, including injuries from car crashes. And over the last couple of years, pedestrian and bicyclist injuries have been increasing rather than decreasing. Transportation infrastructure shapes whether or not people engage in physical activity in their daily routines. And we know that low levels of physical activity are associated with about $117 billion in healthcare costs every year. Air quality, motor vehicles are a leading source of air pollutants such as diesel, particulate matter, and nitrous oxides that contribute to the formation of ground level ozone. And really importantly, transportation is critical in providing access to essential places and essential services. Many people don't have cars, don't have the money to keep their cars going, or can't drive for a variety of reasons. Next. So, oops, two of my slides seem to have are missing. I had two graphs, so I'll just leave that there and just say that, there we go. There's been a lot of studies documenting that the health benefits of active transportation are very substantial. And I think that we need to keep pushing to make sure that active transportation gets its share of funding as we invest in climate and health friendly infrastructure. This is just a study that shows some of the benefits relative to even the benefits of decreasing air pollution from physical activity. Next. And as physical activity and through active transportation increases in terms of minutes per day for people in the population, the disability life years impacted by chronic illness significantly decreases. And now back to the policy slide, if you will. Thank you. And so we have two specific recommendations about how we can enhance inclusion of health and health equity in transportation policy. One is to establish a climate and health equity officer in the Department of Transportation, whose job would really be to help the Department of Transportation as it considers climate investments to pay attention to the health equity implications as well. And the second, which is related, is to more proactively assess the health risks and benefits of climate policies to ensure that our transportation policy and investments optimizes health benefits and averts the exacerbation of health inequities. So with that, I will turn this over to our first speaker. Andrew Wishnia, who is the Deputy Assistant Secretary for Climate Policy at the U.S. Department of Transportation. Welcome, Andrew, and thank you so much for joining us today. We really appreciate it.
Well, thanks so much, Linda, for that introduction and for that topper. I just wrote down this Climate and Health Equity Officer. I think that's a really interesting idea. And Linda, I would just say, you know, after my remarks, if you want to send me some more information on that, I'd be really interested to speak to you and anyone else who was involved in that idea. But my name is Andrew Wishnia. Like Linda mentioned, I'm the Deputy Assistant Secretary for Climate Policy at the Department of Transportation. I help coordinate all of our climate policy throughout the department and in the modal administrations. And it's so great to be with you all and to be with the esteemed panel who's joining me. You know, just a little aside, I have two daughters. One is 4 months old, and the other is 5 years old. And right before I joined you all, I went upstairs and I noticed that my wife was painting our entire sort of second floor. And if I would have spent more time with my family over the course of the past month, I probably would have known that that was going to happen. And I'm saying this half jokingly, but you know, these kind of jobs just really take an unbelievable toll on everyone that's you know, that's involved in the administration, and I would say stakeholders to that end as well. Everyone's plate is really full, and so I you know, I can only speak for myself personally. I you know, am willing to take that sort of sacrifice because you know, I truly feel, and I don't mean to sound trite, but I truly feel like this is such an important moment in our nation's history to do as much as we can to improve climate and health outcomes. You know, so let me start here. I would say that the president, you know, has been committed to net zero by 2050 and has, you know, compelled his administration through executive orders. I would say required through executive orders that we, you know, act in earnest to address the climate crisis. So we're actively moving forward through two primary executive orders, 13990 and 14008, with a whole bunch of different work streams that I could spend probably the better part of today talking to you guys about. But I think the way that it might be most helpful to talk to you about net zero by 2050 is sort of what we at the Department of Transportation are doing to ramp up toward that goal. And I would put you know, what we're doing into kind of three primary buckets, and these aren't exclusive buckets, but it's just a sort of a good way for me to compartmentalize what we're doing and what we still have to do. And that is, you know, that we're seeking solutions to reduce trips, shift trips, and improve trips, right? So within the reduce trips bucket, we're looking for healthy outcomes to you know, toward what everyone is here for. And that includes things like active transportation, improved bicycle infrastructure, excuse me, improved bicycle infrastructure, improve pedestrian infrastructure, more complete streets, better land use planning. And toward that end, we have new guidance that came out the door within the past few weeks that now allows for renewable energy projects along the highway rights of way. So that's sort of the first bucket, reduce trips. The second bucket, shift trips. Where possible, we don't want to necessarily force people out of their car by any means, but where possible, we want to provide opportunities for increased access. So by that, we're looking for increased opportunities for transit, increased opportunities for rail. And then the third bucket, improve trips. You know, in addition to reducing trips and shifting trips, we know that we have the transportation system that we have. So we're looking to sort of here now, what can we do to, you know, improve fuel economy? What can we do to look at road pricing strategies? What can we do to improve transportation electrification opportunities throughout the highway system and throughout the transportation system as well? So that's kind of how how we're, we're thinking about prioritizing, reducing trips, shifting trips, improving trips. And obviously all of that has to be undergirded by a strong performance management regime. You can't measure what you don't manage. So we're looking carefully at sort of how we're measuring emissions in other sort of national priorities of the Biden-Harris administration, whether it's related to safety, equity, climate, or economic security, and also better data as well. So better performance management, better data, including climate modeling and the like. So that's kind of the policy bucket. Equally as important is the process bucket. And so I just wanted to briefly mention that we also stood up a climate change center recently as part of kind of the process architecture. And what we're really thinking about is, while it's nice to have priorities or initiatives related to climate change policy, we're really trying to institutionalize and embed climate practices across the department and across all of the modal administrations as well. So Dr. Robert Hampshire and I sort of co-lead the Climate Change Center, and that serves two functions. One is a process management function to ensure that all of the executive orders, all of the guidance and other material that comes from the White House and the Secretary's office, that's all operationalized. And then we also want a forum, right? We want to provide a space for all of the climate thought leaders across the department to engage, interact, and look at policies holistically and multimodally so that they can be approved and shared with the department. We also want to socialize, what we know with our other sister agencies, and we're working closely with the Department of Energy, EPA, the Council on Environmental Quality, and we're looking to do even more in the weeks and months to come. So hopefully that provides kind of a 10,000-foot view of what it is that we're sort of prioritizing and focused on, both on the policy side and the process side. And then, like I said at the outset, we're obviously our top priority, one of our top priorities in the climate space is looking at the executive orders, implementing those executive orders, and then looking to see what else we can do administrative, regulatorily, and legislatively. Lastly, I should mention the American Jobs Plan. The American Jobs Plan is obviously, the president's plan, a large portion of which includes funding for our nation's infrastructure and transportation infrastructure, specifically over $600 billion. That includes additional funds, significant additional funds for biking, walking, active transportation, transit, rail, transportation electrification. So I'm happy to answer some questions along those lines, but we're obviously staying busy in these first few months. And we have a lot to show for it, but we have a lot of work to do. So thanks so much for having me, and look forward to this afternoon's discussion.
Thanks so much. It's really exciting to hear the change in perspective at the Department of Transportation and the commitment to really think about how DOT can address the climate crisis and build in health as well. So thank you. And I think we're going to hold questions until the end. Our next speaker is Ben Samuels, who works our next speaker is Charles Brown. I'm sorry. And Charles works for a not-for-profit called Equitable Cities, and also teaches, and he is going to come to us via video.
Good afternoon, everyone. Welcome to Equity Matters, creating safe, healthy, and inclusive transportation systems for all. My name is Charles T. Brown. I'm founder and principal of Equitable Cities. What is equity? Equity involves trying to understand and give people what they need to enjoy full, healthy lives. Equity is also the presence of justice and fairness within the procedures, the processes, and distribution of resources by institutions or systems. However, equity isn't just a desktop exercise. Facing equity issues requires an understanding of the underlying or root causes of inequality and oppression within our society. This is important because many have stated that transportation has been weaponized as a tool of oppression within our society. And to make this clear, the ways in which transportation has oppressed many, particularly Black and Brown and low-income communities, is through the lens or efforts surrounding highway robbery, where many highways, interstate highway systems, et cetera, or simply plowed through many Black, Brown, and low-income communities throughout the country, such as the one shown here in New Orleans. We also know the intimate connection between transportation decisions and the impact it has on the climate. My own personal experience was having experienced both Hurricane Katrina and Hurricane Sandy. Then there's data to show quite clearly the impact of transportation decisions as it relates to traffic violence. For instance, when we look at it through an equity lens, we see that those most at risk include older adults, people of color, and people walking in low-income communities. However, what we've seen is that too often in the transportation sector, many start with the behaviors of pedestrians, motorists, and cyclists, and then progress to talk about disease and injury, and then later, of course, mortality. They take the really downstream approach versus the upstream approach that public health has started to take. And this is important because what we understand is that risk behaviors, disease and injury and mortality are intimately tied to one's living conditions and then the bidirectional relationship between social inequities and institutional inequities. And as a result, what we find when looking at this is that race then determines one's place, which determines one's health. So what we find is that history doesn't say goodbye. History says, see you later. And you may ask, what is that later? Well, history is telling us 3 things should take place as it relates to transportation. We should increase access to alternative modes of transportation, such as biking and walking, electrify our personal and public vehicle fleet, particularly our school buses, and embrace micromobility options such as e-scooters. And why should we do that? Well, for one, we are racially segregated in terms of the places that we live. For instance, here you see the map of the city of Miami. Blue represents where the majority of our white brothers and sisters live. Green, our Black brothers and sisters. Purple represent Hispanics. The other color represents our Asian brothers and sisters. And you can see whether it's Miami, whether it's Houston, Texas, whether it's the nation's capital in Washington, D.C., or Portland, Oregon, we are segregated by race. So then the question is, how can we create a safe, equitable, and inclusive system for all? Well, we need a framework that centers justice. And in that justice framework, one must ask the question around distributive justice. Who has access or physical access to that street, to that park, or to that trail? Next, we must ask the question around procedural justice. Who has influence over the design, the operations, and the programming of these spaces? Thirdly, we must ask a question around interactional justice. What makes people feel welcomed or unwanted in a space? Next, we must ask the question around representational justice. Do people feel their experience and history is represented in that space? And then lastly, care. How do people demonstrate their care for the space and other people in it? This is of importance to me because I think in the Black community, our mobility has been arrested. And so you may ask, what is arrested mobility? Arrested mobility is the assertion that Black people and other minorities have been historically and presently denied by legal and illegal authority the inalienable right to move, to be moved, or to simply exist in public space. This unfortunately results in adverse social, political, economic, and health effects that are widespread and intergenerational, but they're preventable. And so how does this happen? It happens via over-policing. I define over-policing via 3 distinct forms. The first one is policy. For instance, racialized zoning and land use practices. The second one is the traditional form of law enforcement, such as enforcement at the local, state, and federal level. And then thirdly, the self-deputization of white citizens. This trifecta works, whether deliberately or not, to control the movement of Black bodies in America, thus arresting their mobility. But what are some of the adverse impacts? Well, we find that Blacks are less likely to be physically active than whites, regardless of the neighborhood or individual income level, and regardless of the racial composition of their neighborhood as well. We also find that these communities, Black communities, are disproportionately associated with food deserts, made even worse by a lack of access to transportation options. And then lastly, we find that transportation disadvantage has political consequences, as it makes Black people more vulnerable to disenfranchisement efforts like a lower density of polling places. So it's been a pleasure speaking with you about this today. And I hope we could talk further about arrested mobility and what we can do to better connect our transportation decisions with our ways and means as we go about protecting the environment. Thank you very much.
Our next speaker is Sam Rockwell, who is the Executive Director of Move Minnesota. And I will turn it over to Sam.
Very good. Thank you, Linda. And thanks a million for the invite to this conference. Next slide, please. My goal here is to talk a little bit about the dynamics of transportation and climate, and then really of some of the multiple benefits of addressing our transportation emissions through active transportation, including transit. So this slide, I start almost all these presentations with this slide. It's not a transportation slide, and I know that this is a climate conference, but I think it's always incumbent as many times as possible to articulate how significant and quickly we need to move to reduce our emissions. And because of that speed and magnitude, it actually has a lot of implications for how we can achieve those emissions reductions in the transportation sector. You know, we saw earlier this week the International Energy Agency report that came out on Monday articulating this as well. You know, speaking in the energy sector, the executive director, Fatih Birol, said if governments are serious about the climate crisis, there can be no new investments in oil, gas, and coal from now this year. And that kind of thinking really translates into the transportation sector as well. Next slide, please. Transportation plays a smaller emissions role globally, but as we heard earlier from Linda, it's a leading source of climate emissions here in the United States. It is in Minnesota as well, and the greatest percentage of those climate emissions are from the cars and light-duty trucks that we drive, not from the freight and airline traffic. So next slide, please. We hear a lot, and we heard a lot earlier this week about the importance of electric vehicles, and it is absolutely critical that we electrify our fleet. Great news of the Ford F-150 earlier this week, but we can't do it with electrifying alone, right? We saw that even in this IEA report about the energy sector earlier this week. We really need to reduce how much we drive as well. And part of this is because of that pace of change, right? If we are going to hit that timeline articulated earlier by Andrew of 2050 net zero, our cars are built well. The average lifetime of car is somewhere between 15 and 20 years at this point. And so when you kind of reverse engineer that replacement cycle of how often do you replace it every 15 to 20 years, we would need to be selling basically 100% electric vehicles in about 8 years in order to have no gas vehicles on the road by 2050. And so what we can do, and right now we have about 1% of the vehicles on the road are electric. And so that is an enormous hurdle to get over. And it's one where we shouldn't put all of our eggs in that one basket, and we can reduce how much we drive. In the Minnesota context, the cities of Minneapolis were the first to do an analysis of what they would need to do to reduce how much they drive. And I've got the term VMT up here, which is the shorthand for vehicle miles traveled. And Minneapolis found they needed to reduce VMT by 38% to reach an 80% reduction by 2050. St. Paul, our second biggest city in the state, by 50% by 2050 to reach net zero. So big targets. And part of that is because the state needs to reduce its vehicle miles traveled by about 20%. And you've got to be able to reduce greater in places where it's possible. And where it's possible means you have the land use patterns for walking and biking and for transit. And that underscores what we need to do to reduce VMT. We can't just ask people not to drive. We need to provide those alternatives. And right now, we really don't have choices because our transit is inadequate in too many of our communities. Our biking and walking options are inadequate in too many of our communities because people don't feel safe, people aren't safe, and it takes just far too long. Next slide, please. We also need to be reducing how much we drive because of all of the auxiliary benefits. These flow certainly into the health arena. In some of those items, again, that we saw from Linda earlier, reducing particulate emissions, reducing noise pollution and stressors related to noise pollution, increases in physical activity, including with transit use. There are a number of studies, not just for walkable communities, but for transit accessible communities, those who commute by transit, because you're walking to and from the trains, biking to and from the trains, get significantly higher levels of physical activity every day, just because there's a request to eliminate the gray bar, just because you're walking to and from those trains or buses. And it also, by reducing how much we drive, allows for the space, the limited space we have in our streets to be used for something else. I think this is an underappreciated element of shifting from a driving-centered and car-centered transportation system to a more multimodal system, is when you are able to reduce how much folks drive, you're able to use that space for trees, use that space for walking, for biking infrastructure, and so forth. We see the pictures on the right here are Burlington, Vermont. From a similar perspective, you can see the same church down at the end of that street. And this is the transformation of uses on this street from a car-centered street to a pedestrian and greening-centered street. Next slide, please. In addition, there are major access. Oh, I forgot I had this slide in here. This is a slide which just demonstrates that geometry difference of how much you can, how many people you could move via these different modes, whether it's transit, biking, or cars. Next slide, please. In addition to those direct health impacts, the question of access, what you can access, whether it's a grocery store, as we just heard in the last presentation, to solve a food desert, or your job, or your friends, social interactions is critical and flows into health impacts related to economic security and stressors related to how folks' time is used. So these graphs here, or these maps here, are in the Twin Cities from the University of Minnesota, but there are similar outcomes and maps in most cities, not all, but most cities in the United States. On the left, the dark red is the amount of, the left-hand map is the amount of jobs folks can reach in 30 minutes in an automobile. Dark red is 1 to 2.5 million. And on the right is the same map for transit access. And that yellow, you can see right there in the center, is 100 to 250,000, right in the center cities. And so it gives a sense of how much more limited people's access is and how much more intrusive the amount of time it is to get to a given destination via transit versus car, taking people away from their families and limiting those opportunities and creating major life stressors, which flow into health outcomes as well, and of course, flowing through those equity outcomes. And so what do we do about that? You know, we started to see some real changes at the state level and at the city level in the Twin Cities. We've seen a coordination between the core cities of Minneapolis and St. Paul to reduce our speed limits in the cities to a 20 mile an hour speed limit, to reduce our, or to create more flexibility in our land use patterns. The city of Minneapolis legalized creation of up to 3 units on every lot in the city, and increasing infrastructure in painting quickly bike lanes, bus lanes, and so forth. Next slide, please. A lot of this comes down to funding and regulation at the federal level as well. And I know that one of the requests here is to think about what we can ask for at the federal level. So the first is really in the weeds, but it matters. So the public comment period, a reopened public comment period for the MUTCD, the Manual on Uniform Traffic Control Devices, was just closed, and we are attempting to get the Department of Transportation to kind of scrap what had been started to be developed in the last administration, really limiting the benefits for biking, walking, transit, and so on. And emphasizing maintenance of existing speed limits, which has incredible health effects. 20 miles an hour, if someone is struck at 25 miles an hour, they have a 5% chance of dying, whereas at 40 miles an hour, 85% chance of dying. And also just to increase the amount of funding for transit, biking, and walking. Historically, it's been an 80% to highways and 20% to transit, biking, walking. And finally, the last slide, when you are talking to your congresspeople, senators, this is really popular. I mean, there is research done on the Minnesota level, at the Twin Cities level. This is from the United States, across the United States. People want to have better biking, walking, transit options, and they believe that the country would benefit from it. And so articulating how this is popular with constituents across the United States is critical. Thank you.
Thank you so much, Sam. It's very inspiring to see what you and your colleagues in Minnesota have been able to do on this front. And I hope we can all learn from your experience there and apply it in the Federal Transportation Investments Forum. Our next speaker is Ben Samuels, who is in the office of Governor Charlie Baker in Massachusetts, and will be talking to us about the Transportation Climate Initiative.
Perfect.
Yeah.
Thank you, Linda, and appreciate all of you taking the time today. As Linda said, I work for Governor Charlie Baker, and I'm talking about the Transportation and Climate Initiative program. So if you want to go to the next slide, please. So the Transportation Initiative Climate Program was launched towards the end of last year when Massachusetts, the states of Massachusetts, Connecticut, and Rhode Island, and Mayor Bowser in Washington, D.C. just signed the Bipartisan Transportation and Climate Initiative, MOU. So the primary goal is to reduce carbon emissions from the transportation sector by at least 26% over the next 10 or so years. And that's important for all of the obvious reasons, but particularly in the Northeast and Mid-Atlantic. I think earlier we talked about nationally, carbon emissions are about 30% of carbon emissions. In the Northeast and Mid-Atlantic, it's closer to 40%. And that share continues to grow as the power sector in the Northeast and Mid-Atlantic gets more efficient as a function of the Regional Greenhouse Gas Initiative, among other things. And even throughout COVID, transportation emissions are not down all that much, and they are back to where they were in a pre-COVID baseline, and in fact have been there for several months. So this remains an urgent problem for us to address, and that's the primary sort of importance of addressing transportation, but also focusing on that sector in particular. So if you go to the next slide, with that said, beyond just the carbon benefits, there are really important other benefits that we get from TCI-P as well. It allows us, the proceeds from the program allow us to invest in equitable, cleaner transportation options. And that in turn creates jobs, allows us to invest more aggressively in infrastructure and boosts economic development across the region. Additionally, and particularly pertinent for the topic of this session and this conference in general, there are substantial public health outcomes that come from addressing emissions in the transportation sector. So a lot of that comes from the fact that by reducing carbon emissions and other GHG emissions from the transportation sector, you reduce smog, you reduce pollution, and in so doing, you increase air quality, which leads to fewer deaths because of respiratory illness, asthma, things like that, as well as increased public safety from fewer vehicular deaths and things like that. So if we want to switch over to the next slide, it just gets into some of the specifics of what we can accomplish with this program. The TCI-P is set to raise well over $3 billion as a projection over the next 10 years for the region. And I'll get into the specifics of what we will and can use that to do and what we're hoping to do, in addition to the goal of reducing carbon emissions from transportation by that 26% clip over the next 10 years. And beyond that, and I touched on this a moment ago, it's hundreds of millions of dollars of health savings and health benefits every year through the TCI-P because of these the reduced air pollution, the reduced smog, and therefore lower hospitalization rate, lower premature death rate, fewer cases of asthma, things like that. So jumping into the next slide, I'm going to talk a little bit about how TCI-P works and, more importantly, how we can use the proceeds from this program. So the TCI-P, and the way that it works is that it's a cap and invest program, which is different than, and we think better than, a traditional gas tax as far as reducing carbon emissions from the transportation sector. And it's better than a gas tax for a few different reasons. First and foremost, the design of this program guarantees emissions reductions over the life of the program in a way that a gas tax cannot. So the way it works is that we sell what are called allowances, effectively the right to emit a certain amount of carbon to fuel suppliers, and the number of allowances that are sold every year ratchets down, and so the amount of carbon that can be emitted from the sector ratchets down in turn. But what that does is it creates an economic incentive for fuel suppliers to innovate, most notably by creating lower emitting fuels, which would then compel them to buy fewer allowances, which means that they're more competitive in what is already a very competitive marketplace. So by creating that economic incentive for fuel suppliers to create lower emitting fuels, we think that there's real opportunity there. It also ensures regional consistency in terms of pricing across the entire TCI-P region. And that's important in a part of the country where a lot of people cross state lines on a day-to-day basis to work and live. And so that's something that matters to us as well. But this guaranteed pollution, emissions reduction and pollution reduction matter a great deal. And with the $3 billion, or more than $3 billion that the program is set to generate over the next 10 years, that will allow us to make all sorts of investments in cleaner and cleaner transportation, public transportation, and other transportation alternative options. So that includes a lot of the things you might expect: expanded public transit access, EV rebates, and charging infrastructure, as we expect this number of electric vehicles to go up from its current 1%, particularly with a federal government that is probably more inclined to support EV and other electrification infrastructure. But it also includes things that you might not traditionally conceive of as related to transportation. And I think one good example of that here are investments in high-speed and broadband internet access. Not directly related to transportation, but when rural communities and lower income communities have less access to public transit, to high speed and broadband internet access, it makes it more difficult to work from home. It makes it more difficult to practice, say, telemedicine. And so I think the design of this program is to give people more choices as far as transportation goes, and make it easier for people to choose lower emitting options, and if they so choose, to drive less. And I think we're excited by what we can do with those investments. Beyond that, and if you want to go to the next slide, what makes the TCI-P unique and fundamentally different from any previous Cap and Invest program before are the significant commitments to overburdened and underserved communities that are included in the program design right from the get-go. So all of the TCI-P jurisdictions have committed to investing a minimum of 35% of annual proceeds in these underserved and overburdened communities. And by the way, there's nothing that precludes any of these jurisdictions from investing more than 35% if they so choose. And what that means is that at least $1.1 billion of cumulative investments across these TCI-P jurisdictions will be allocated to programs, to infrastructure, to investments that directly benefit overburdened and underserved communities. And this is critically important for a number of reasons, obviously, and a number of the earlier speakers have touched on this. There have been, historically, there has been underinvestment in a lot of these communities, and this is a way to help address some of that. Additionally, we know that communities of color, low-income communities, are disproportionately burdened by the negative health outcomes like asthma and other respiratory illnesses that are associated with the pollution and smog of driving in the first place, which is one of the things we're trying to address. The way that we're going to do this, each state is spinning up an advisory body with diverse representation to help us better understand who are the overburdened and underserved communities, what are the right sort of investments, and how do we move forward with things that help these communities. So to the last slide, please. So there are 8 other states geographically. You can think of it from Vermont down to North Carolina who remain engaged in the process. And we expect and think that over time, more and more of these states will join in the next couple of months and years. In addition, the draft model rule is available online for those of you who are curious to dig into the regulatory scheme a bit more. But in terms of what you can be doing to help, I would say call your state officials, call state legislators, particularly if they're in the TCI program but haven't yet signed the MOU, and encourage them to join what we think is a really important and valuable and additive program that will help us reduce carbon emissions from the region, that will help advance the cause of equity and environmental justice, that will allow us to invest in our economies, in our transportation infrastructure, and create jobs. So with that, I really appreciate your time and look forward to taking some of your questions at the end.
Thanks, Ben. We really appreciate your time. It's very exciting to see this kind of regional collaboration, and also exciting to see that you're really paying attention to addressing the kinds of inequities that Charles outlined proactively. Our last speaker for this panel is Dr. Bob Kitchen from Virginia Clinicians for Climate Action. And I'll turn it over to Bob, and then hopefully we'll have time for a couple of questions at the end. Bob.
Thank you, Linda, and happy to be here today representing VCCA. Colin, can you skip the next slide and go to number 3? Okay. VCCA's focus this year has been on transportation's impact on the health in Virginia. And you can see here that compared to the national average of 28%, 48% of CO2 pollution in Virginia comes from transportation. Next slide, Colin. And these are some of the medical conditions that are due to the transportation pollution. Next slide. Skip this one. Okay. A major component of the pollution from transportation is particulate matter 2.5. This graphic shows that it's a very tiny particle, 2.5 microns, and compare that to the width of a human hair at 50 to 70 microns in diameter. Skip the next slide, Colin. And the mechanism of injury of PM 2.5 that's inhaled into the lungs, gets to the alveoli, from there can enter the circulation, gets circulated to the body, set up systemic inflammation leading to damage to the cardiovascular, pulmonary, and CNS systems. Skip the next slide, Colin. VCCA want to have a better understanding of the impact of PM 2.5 in Virginia, so we commissioned this study along with the Energy Foundation of the health burden of PM 2.5. Next slide. There are many sources of PM 2.5 in Virginia, not just transportation, and all PM 2.5 in Virginia leads to 3,000 deaths, and you can see the high number of these other conditions. And the health associated costs are $23 billion annually. Skip the next slide. Now, when you get down to transportation itself and PM 2.5, all vehicular transportation, meaning that coming in from out of state as well as Virginia, leads to 190 deaths. You see the other numbers as well. And now the cost is $1.6 billion. Next slide. And Virginia specific transportation is responsible for 92 deaths. And you see the heart attacks, et cetera. That cost is $750 million. Next slide. This slide shows the distribution of socially vulnerable populations as defined by the CDC across Virginia. The most vulnerable of these populations experience a 61% higher death rate in Virginia due to air pollution. Hence, they would stand to gain the most health-wise with cleaner air. Next slide. The transportation report then projects that the benefits by 2035 of a zero-emission vehicle program, which will include cleaner electricity generation per the recently passed Virginia Clean Economy Act, will be a decrease in mortality by 11 cases, non-fatal MIs by about 7, new cases of asthma by 18, and lost work days by 760. The numbers in parentheses were those conditions when you had just Virginia-specific pollution. Skip the next slide. Each January, VCCA has an advocacy day where we go talk to our legislators about legislation which we think is important to protect the health of Virginians. Next slide. This January, we focused on these bills, the top 3 of which were specifically related to transportation. Next slide. Advanced Clean Car Standards was the major legislation this year. And one of the components of that is to increase the adoption of EVs. So this graphic shows that if you drive an electric vehicle in Virginia compared to a gasoline engine, there's a 67% reduction in the CO2 being released. Next slide. And Advanced Clean Car Standards, basically an adoption of the stricter emissions standards formulated by California and made available to states by Section 177 of the Clean Air Act. The specific areas addressed are air quality, global warming, and zero emission vehicles. Next slide. This legislation was passed by the General Assembly this year and applies to vehicles starting with model year 2025. So Virginia has now joined 13 other states in the district who have adopted these standards. Next slide. The next piece of legislation had to deal with electrification of school buses. And the first 2 bullets on the slide show that an electric bus is cleaner both on the road and inside the bus than the diesel bus. And the bill created an electric vehicle grant fund, which will help school districts cover the difference in cost between a diesel bus and purchasing an electric bus. This was passed by the legislature and just last week received funding by $20 million from the VW Dieselgate settlement. Next slide. This has to do with air quality monitoring. And we supported this bill to conduct a study with the goal to increase the number of monitors within the state, as well as identifying the best locations for these monitors. Our transportation report had found there were significant limitations in air monitoring data due to a small number of monitors. And this was also confirmed by the American Lung Association's State of the Air report. This had been a separate bill, but was rolled into the environmental omnibus bill, which was not brought up to a vote this past session. And skip this slide and we'll go to the last one. So skip that one. There we go. No, skip this one, Colin. Okay. Thank you for your time today. I appreciate the opportunity to describe VCCA's focus on transportation's impact on health, the findings of our transportation report, and this year's transportation-related legislation. And I'll be happy to take questions during the Q&A.
Thank you so much. And I really hope that other of our clinician action groups across the country can tap into some of the resources that you identified and think about how to use the work that you've done to expand their own ability to impact legislation and funding in their own states. So we're very short on time. So I'm going to start. I'm going to just start with one question. And it's sort of sprinkled throughout some of the questions that have been coming in, but it's really how can the medical and health communities most effectively engage with policymakers and transportation planners to ensure that our transportation planning and investments have a positive rather than a negative impact on health and health equity. Maybe we can start with Andrew.
Thanks for that question, Linda. And wow, I mean, that was just such an impressive amount of information from the folks on this panel. Look, I would say, as I might have mentioned in my remarks, we have a really unique moment in history right now. The president has released his American Jobs Plan, which has $85 billion for transit, $80 billion for rail. It has, additional funds for roads and bridges, not just to, modernize roads, but to actually fix them right. So we have funds for bike infrastructure, pedestrian infrastructure, and this is really a historic opportunity for transformative investment. And that's really what we need, right? It's not business as usual. We need transformative investment. So just to kind of the call of your question, Linda, I would encourage folks to talk to stakeholders of all stripes. And I have to be careful with sort of how I phrase that, but I would encourage, folks that are listening in to talk to, decision makers across the board to make sure that their voice is heard. This is really an inflection point as well, given the fact that both the Senate and the House are considering and contemplating a surface transportation bill. So there's really no better moment than now to make your voice heard with respect to the American Jobs Plan and with respect to the values that this group holds so dear. And thanks again for having me.
And do you want to tag on to that in terms of state policy and investments?
Yeah, I don't have to, I wish I had a more sort of nuanced answer, but working with advocacy groups who engage with elected officials, talking directly to your state rep and state senators, calling, writing the governor's offices, writing letters, it really is as simple as that. You would be amazed how often in the conversations I have with governor's offices and with elected officials in other states, how often the sort of extent to which the public is engaging or not engaging on this particular issue matters. And I think particularly with all of you, healthcare workers, physicians, people who know this space, who can speak to the nuances of why this matters, not only from a climate perspective, but from a public health perspective. And also that this saves us money from a public health perspective is much more valuable than you might think at face, and would really encourage you to engage in that way. So don't overlook some of the simple stuff. We really do pay attention to it. And I know from my conversations that others are as well, and appreciate all of your help and the work you've done so far.
Great. I believe that unfortunately we are at the end of our time because we want to give people at least a minute for a bio break before the next session starts. So I want to thank again each of our panelists. It's really exciting to see how much movement there has been around bringing transportation, health, and equity together, and where there's so many opportunities And we look forward as the health and medical community to working with advocates like Sam and people like Ben and Andrew in federal and state government to take advantage of this moment and get a healthier and more equitable transportation system. Thanks.
Thanks so much, everyone.
Welcome. Thanks.